someone sent me this reel on Instagram, and I have talked about the husband stitch before, but I think that it's important to talk about it again, especially as we have a political climate that is consistently attempting to take away women's bodily autonomy. The husband stitch is something that does this. So, this man right here, he says this is the look that he gives when your patient just gave birth and the husband asked you to throw in an extra stitch. So, what is the husband stitch exactly? After a woman delivers a baby naturally, there could be some natural tearing down there, and there could be some need for some stitches. But what the husband stitch is doing is making it unnecessarily tight down there, tighter, simply for the benefit of the man. And what this is also is it lacks informed consent. The reason why it's called the husband stitch is because the husband or the male partner is typically the one that is requesting it. If a woman happens to be the one that is requesting it, at least there is some informed consent and she knows that it is going on. But what we are seeing, and it's been discredited as even being necessary, that there lacks informed consent. And back in the day when doctors were usually male, usually white, they were, looking out for their fellow man. I'm a dad myself. I understand. Without any regard to women. And what they have found is this stitch makes it incredibly painful for women. And like I said, it's unnecessary. Our bodies heal and everything does snap back together. Typically, even if you need to do some Kegels or whatever, exercises, everything come back together. So, yes, we needed to talk about this. Now, let's talk about some of the comments on the post. The comments on the post were egregious. Now, I doubt that this person is a doctor. I highly doubt it, because when you swoop in and you say, "I was a doctor," okay, but whatever. Even if he's not a doctor or this is a joke, it's still egregious. He says, "As a doctor, I usually just add the stitch myself, even if the husband doesn't ask for it. I'm a father of 5, and I can relate to the struggles of my fellow men." And someone says, "Get help. Disfiguring a woman's cat is not funny or okay." Like this, even if it is a joke, it's quite a terrible joke because it takes away from, like I said, women's bodily autonomy and opportunity to say yes or no to something. Tyler said, "God forbid something gets done for a man. How dare we ask for anything? We need to stay in our place and continue to give all for nothing." So a woman's body is supposed to be disfigured. Even after a woman just gave her body to building a baby and going through all that goes with labor and then trying to get her body back together and hormone fluctuations. But yes, we should be worried about a man's relations. That's what we should be worrying about. It's so challenging because these people just simply cannot take themselves out of the equation and why their needs are more important than the woman's healing and the woman's bodily autonomy. And then Tyler says at the bottom, "They are already stitching her up. What's one more? If guys get an operation to more successfully pleasure a woman, we would." I guess that's supposed to say if guys could get an operation to more successfully pleasure a woman, we would, maybe. But I doubt it. And throwing in hypotheticals doesn't matter because the consent is important, informed consent. This person says, "Because it actually hurts the woman, and the men that ask for it don't care anything about anything but their own pleasure." And then Tyler says, "It hurts them after the surgery, like having sex." If that's the case, then that's understandable. Why would the doctors even have that option? They don't. They shouldn't. That's the whole point. This person says, "We ask him how small he needs it, and that usually stops the request." Okay, so this is a man talking. "When our first child was born, the doctor made the comment that he had to put stitches in and that he added a few extra. Fast forward several months, and sex was extremely uncomfortable for my wife. Turns out the extra stitches he put in were not the kind that dissolve over time. 2 surgeries and a lawsuit later, So they sued him. And then Anna says, how did she figure out that there is an extra stitch other than feeling uncomfortable? Is it visible that there's an extra stitch, or I'm sorry, just curious to know. And then the man says, it was uncomfortable, and I ended up taking a look, and I could see one of the two. Of course, by then they were under the skin, and that's why she needed an additional surgery to get them removed. Someone asked, did you guys win a lawsuit? And he says, yes. Then someone says, is your wife okay? And he says, yes, she's fine now. So having to have surgery to fix something that shouldn't have been done in the first place. That's the reason why I said that this is egregious. It's a violation, and women should have the opportunity to say what they want to do with it. We should have the opportunity to say what we want to do with our bodies, not just these random people making decisions for our fellow men because I'm a man. This woman says, had this done to me, 8 years of pain, as if having a vajayjay didn't come with enough pain and annoyance. Now I can't even put in a tampon. And then she continues with, yeah, it definitely was not what I imagined would be an issue, as I didn't know what a husband stitch was. So when the OBGYN mentioned an extra stitch to retain tightness, I was confused, but brushed it off. Then, after so much pain, I somehow stumbled upon this term and practice, and it all clicked. Now I'm just kind of stuck with it. That's really sad. The doctor should have made sure you understood completely and understood the benefits and negatives. And she says, it's not even a legal practice anymore, I don't think. I don't know if it was then, but yeah, there was no consent. He was already down there stitching up, so he just did it. This is the reason why it's just so tiresome that people do not understand why women want. It's not even that we want extra rights, we just want rights to our own bodies. So that's all that I have right now on the husband stitch. But I do want to use this as a jump off discussion, talking about informed consent, women's rights, why this is not just. Why women's rights does not just encompass reproductive rights. It includes all of the things that have to do with our bodies. Men do not have to go through this. There is no time that informed consent is just pulled from a man dealing with this type of thing. So why do these people in charge think that it is perfectly fine to take away a woman's right to consent to things? Why? This is the reason why we need so many more women in the medical field, in these decision-making fields, because this should not happen. But I want you guys to jump in the comments and let me know what you think about this. Have you had it done? Have you heard of anyone having it done? Let's just continue the conversation.